Dr. Ledlow, thank you so much for joining us here on Health Connection. Our topic is Northeast Texas, the state of its health. And we're going to find out here that it's not everything we might want it to be. First question, UT Health Northeast just published a book called The Health Status of Northeast Texas. In broad terms, what is this publication telling us?
It tells us a lot of important information. First, if Northeast Texas, the 35 counties in Northeast Texas, were its own state, which is about the size of West Virginia, it would rank 45th out of 51 states in the state health rankings, which means there are 44 states much healthier than Northeast Texas would be. So we have significant deficits to overcome in certain disease states such as heart disease, stroke, and COPD, and other areas, lung, colorectal, and skin melanoma cancer, to name a few.
Well, that's a fairly strong indictment. To what do we attribute that poor performance?
Well, much of it is lifestyle issues, tobacco use, inactivity, lack of exercise. You can also throw in lack of access to preventive health services and primary care services, to name a few of the symptoms covering the region and the attribution to those findings.
All right. Your area, your academic area, is population health. What is population health?
Well, population health, just like healthcare delivery, looks at treatment, diagnosis, and a treatment regimen with an individual patient who presents with signs and symptoms. Population health is about a public health approach to looking at groups of people, communities, and populations that have health issues that need to be diagnosed, and a treatment or an intervention. Sometimes it's a policy, sometimes it's better air quality or water quality, and the public health professionals focus on improving the population health through those mechanisms and approaches.
You said a moment ago that Northeast Texas would, if it were the 51st state, would rank 45th, but the fact is, in some aspects, it would rank 51st.
Right.
Elaborate on that a little bit.
In some specific areas, such as heart disease, stroke, COPD, lower respiratory chronic illness, we would rank far worse than 45th, anywhere between 47th or 51st out of 51 states.
Northeast Texas is said to be suffering from a shortage of health professionals. Let's elaborate on that a little bit.
Well, we all are, understand that there's a lack of primary care physicians and nurses in rural areas. Well, there's also a lack of public health professionals in Northeast Texas. For example, epidemiologists who look at disease states, both acute infectious disease or chronic disease. Where is the disease prevalent? How do we watch it and surveil that disease state across a population? Those professionals are in short supply. Biostatisticians who help us do analysis on the very complex big data that is required to be analyzed to look at populations and communities and keep them healthy. Health policy professionals who take the data and information and analyses and try to position policies that are more advantageous to keep a population healthy. Community health workers who provide health information and community participatory interventions with local community leaders, along with environmental health scientists and occupational health scientists who look at air quality, water quality, soil quality, and safety concerns in the workplace. All those professionals work together to form the foundational workforce for public health and the workforce that looks at improving population health.
UT Health Northeast is an academic institution in addition to being a clinical institution. So as an academic institution, what is UT Health Northeast doing to address this professional shortage?
Well, this shortage is significant, and with the guidance and leadership of Dr. Calhoun, Dr. Lakey, Mr. Wolkers, Dr. Levine, and others, getting with the state of Texas to encourage us to start a new program to train professional public health workforce members in the goal of improving population health, UT Health Northeast is launching a new Masters of Public Health program starting later this year. This program intends to train active workforce members in the goal of improving population health. It'll be a theory to practice program. We're going to build on theory, teach students the fundamentals and the analytic techniques that go with population health management and improvement, and then place them in practice locations throughout the the region of Northeast Texas in order for them to get the requisite experience to go out and make a big difference to improve the health of Northeast Texas. So in that hope of improving the workforce and adding professionally trained members to that team, the UT Health Northeast is launching this Masters of Public Health program.
And just to be absolutely clear, this is an academic degree.
Correct.
Okay.
It is an academic degree and a well-known degree in the industry, and you will join a team of professionals in health in the industry as a recognized member of that workforce.
Who is a candidate to pursue this degree? Who are you looking for?
Well, it runs across a number of fields, from clinicians, physicians, nurses, technicians, all the way through other fields, biology, chemistry, communication. Anyone who has an undergraduate degree and has a passion to improve the health status of communities and populations would be eligible to apply for this really exciting, important, well-needed program.
Where does someone go to learn more?
Best thing to do is go to mph@uthct.edu or look at the bottom of the screen and contact us, and we'll provide that information very quickly.
Telephone number right there on your screen is where people want to go. Call that number, correct?
Correct.
Okay,
Yes,
very
sir.
well. Doctor, very informative. We appreciate your time. Thank you.
Thank you very much. Thank you.